9:43, welcome back. Malaria, believe it or not, still kills hundreds of thousands of people around the world every single year. And this week, local researchers announced they believe they may be close to a vaccine.
So we spotted this really interesting article from our news partner, the Seattle Times, and we wanted to make sure we talked about it a little more. Scientists from the Center for Infectious Disease Research are thinking way outside of the box with an experimental trial that, honestly, some people have even called crazy. The researcher himself may correct me on this, but so far, it's working.
Yeah, joining us now, the lead researcher on this team, Dr. Stefan Kapi. Did I get it right? Stefan
You
Kapi.
got that right. Thank you for having me.
All right, we practiced. We are
you.
so excited to have you here. We do want to get into the specifics of your findings, but first, I think for us living in the United States, maybe we don't understand what a global impact malaria is still having on people. So why is this so important?
Well, malaria is still a widespread disease, not affecting the US or other developed countries, but mostly developing countries around the globe. It's very prevalent in Africa, sub-Saharan Africa. It's very prevalent in Asia, Southeast Asia, and South America. And it impacts poor people mostly. It's really a disease of the poor. We have to realize that. It's transmitted by mosquitoes, so you get it when you get bitten by a mosquito. And mosquitoes are everywhere, as you know. So malaria is everywhere where there's mosquitoes carrying the organism that causes malaria. And that's a parasitic organism. It's an organism that is much more complex than a virus or a bacterium. And therefore, it's very difficult to fight, very difficult to control and eliminate. And today, we have malaria, again, all over the globe. More than 1 billion, 2 billion people are at risk. More than 200 million people have actually to go to the hospital each year with a malaria infection. And unfortunately, about 500,000 of those die each year. And even more unfortunately, mostly children and pregnant women in sub-Saharan Africa.
So we are headed to India very soon. We're going to start taking medication in a couple of days and take it all the way through. We got all this mosquito repellent. We're going to put it all over our clothes. That's a crazy amount of work. So tell me about this trial that might, and the decades long of work that you guys have been doing that might end all of that.
Yeah, so you described very well what we can do for malaria currently. We can use insecticides. We can use, in endemic areas, we can use bed nets. People sleep under bed nets that are impregnated with insecticides. And to treat, we can use, or prevent, we can use antimalarial drugs, and that's what you take if you go to Africa or to India. Unfortunately, the parasite, the organism that causes malaria, becomes resistant to those drugs, and then you can't cure the infection anymore, and the mosquitoes become resistant to the insecticides, so you can't kill the mosquitoes any longer. And we believe that a vaccine is the ultimate solution to prevent infectious diseases, including malaria, and our vaccine candidate hopefully will contribute to that or will be a major factor in eliminating malaria globally.
How did this trial work? This is not something that you just started doing a couple weeks ago. This is a decade in the making.
Yes, so again, the parasite that causes malaria is a complex organism, has over 5,000 genes in its genome. You know, humans have about 30,000 genes, so it's a very, very complex organism. And the trick for us was to find genes that we can delete from the parasite's genome to weaken it, to basically render it harmless. So it becomes a tame parasite. It's a real parasite, but it can infect you, but it cannot cause disease. But that stimulates your immune response in such a powerful way that then the immune system is trained to recognize the real infectious, dangerous parasite when it infects you out there in the field and eliminates it before it can cause disease. So that is really the trick, to weaken the parasite by genetic engineering, use the whole organism as a vaccine, and stimulate your immune system so it can fight the infection and eliminate it.
There's fear about when you say genetic engineering. People get worried about it, what it could release into life, really. I mean, have you faced that concern and sort of fought back against it?
It's a concern that we are, of course, facing, because genetically modified organisms have a somewhat bad reputation, food items, for example. But first of all, it's for public health. So I think the needs that we really have here justifies the means. So I think, you know, genetically engineered organisms as vaccines that save millions of lives potentially, I think that is definitely something we should consider. Secondly, the way we did this is actually we only removed things from the parasite. We didn't add anything. So if you, for example, have a genetically modified food, you might add something that causes an allergy or causes some problems. In this case, we just removed things. So it's the whole parasite minus 3 genes, and that's it. So we don't see that this could be potentially a problem in terms of exposing people to additional things in this vaccine that could cause problems.
It's like removing the teeth of the great white shark.
Yeah, defang it.
Yes.
Yeah, right.
Exactly.
Okay.
Yes.
So the trial itself has worked up until this point, but obviously we still have a ways to go. So what lies ahead? What's next in your research?
Yeah, so in this trial, as the Center for Infectious Disease Research here in Seattle, trial, what we did is we just proved that we can safely administer this vaccine, and we can really demonstrate that it is safe. Because remember, it is a whole organism. So we had to demonstrate that it cannot cause any problems, it cannot cause any harm, and we did that. So the next step is now to recruit volunteers again from the Seattle community and immunize now repeatedly with this attenuated vaccine and weakened vaccine, and then challenge them with real malaria. And that will tell us if you get protection against real malaria. So we can challenge people with real malaria because, as you pointed out, it can be treated with antimalarial medication. So even if someone becomes infected, we can treat them. So the trial is very simple. You have a group that receives the vaccine and a group that doesn't receive the vaccine. You expose them to malaria. If the one that receives the vaccine is protected, victory, you have your vaccine. And the one control group, everyone will get malaria but can be safely treated.
Okay, last question. We only have a couple of seconds, but people called you crazy for doing this. Are they not calling you crazy anymore?
I think no one calls me crazy.
That's right.
I think it has been quite an extensive period of time where we have faced criticism for what we are doing, but I think that people see this as a realistic and the only way potentially forward for an effective malaria vaccine. So I think the work we are doing is maybe visionary, but not crazy.
Dr. Stefan Kappa with the Center for Infectious Disease Research. We are so thrilled to have you sharing this with us, and congratulations on your work so far.
Thank you.
We're going to continue the conversation a little bit on our Facebook Live. So if anybody's watching and you have more questions for the doctor, please let us know what they are. We're going to keep him after the show a little bit to extend the interview a little bit and ask more questions because there's so much that we can cover. Thank you once again.
Thank you.
Appreciate it.